Sociology is like a big puzzle. Trying to figure out why people behave the way they do and how they might act in the future helps us understand beyond the superficial. By studying different people and how society works, we can gather social pieces that help us make better decisions on how to make the world a better place. By studying different people and how society works, we can gather social pieces that help us make better decisions on how to improve the world.
Welcome to Sociologically Speaking. I'm your host, Rena Risper. This documentary emerged from personal experience and urgent observation. As someone deeply involved in maternal health advocacy and community storytelling, I saw a persistent gap. Many individuals, especially BIPOC women, have the passion and wisdom to support birthing families, but face systematic barriers to certification, training, and professional recognition. The Region 7 Perinatal Quality Collaborative is working to clarify and simplify the certification pathways for doulas in Clinton, Eaton, and Ingham County. Rena Risper here with the New Citizens Press newspaper and the New Citizens Press Community Action Network. We're here to talk about From Passion to Profession, exploring birth certifications and beyond. Since we have been covering infant mortality rates, we have noticed that they were exceptionally high on the national level. In 2023, for every 1,000 Michigan births, more than 6 infants died before reaching their first birthday. 607 infants under the age of 1 died, resulting in an infant mortality rate of 6.1 per 1,000 live births. Michigan experienced a significant decline in infant mortality during the early 1990s, but during the 2000s, the infant mortality rates remained about 7.9 deaths per 1,000 births. I'm a mother, and although obviously I'm not having any other children, I'm really concerned about the infant mortality rate as well as the maternal mortality rate. I believe that all of us in the community have a responsibility to make sure that mothers and their children are living in the healthiest and most supportive environment that we can provide to them as a community, as a business, as just a member of society. Our organization, the New Citizens Press Community Action Network, does several things, but most importantly, we are working on infant mortality and maternal mortality issues currently. We have already filmed 2 documentaries about midwives, doulas, and breastfeeding so that we can educate the general population about how important it is to have someone who's there to advocate for you while you are going through a pregnancy or after you have a child. And then there are some doulas that help you if your child does not, or your children, as with twins, do not make it. It's a really important space to be in, to have someone to support you. And it doesn't necessarily mean that you want the support of your family. You want the support of someone who's not going to judge you. So our goal was to create informational pieces so that anyone could go out and see what midwives do, doulas, breastfeeding consultants, and now we're going to focus on the doula population by exploring birth certifications and beyond, meaning all the other things that you could possibly do to make sure that you are providing the best care possible and also using the resources that you already have available. We have an amazing opportunity to speak with Dr. Lakia Tucker to try to figure out some ways in which we can have a larger conversation about doulas and the work that they do for birthing families. And the possibilities are endless when we're having those conversations. What is the role of an OBGYN in maternal health care? And how do you see doulas as a part of the solution?
Thank you for that question, Rita. The OBGYN or the obstetrician gynecologist is a part of the healthcare team. We get to be a part of that healthcare team, and the doula is part of that healthcare team as well. So we allow for that, we have the patient come in and we work together so that the patient can have their birth story. And I think that you and I have had a conversation about this before, about having their birthday party, right? We like for the patient to be able to think about what does that story look like? What does that ultimate outcome look like for them with the healthcare team? And that doula can help with bridging that gap, if you will, with communicating. And we work together to be able to do that. There can be a language barrier. There can be some cultural barriers. There can be just different barriers so many different barriers that, that may be able to help us to be able to help that patient to be able to have that ultimate birth story that they're looking for.
We've talked before about how things have changed in the medical community. Can you give me some insight as to how the medical teams have been working more so with individuals like doulas and lactation experts to make sure that birth story is something that the pregnant individual feels comfortable with?
Right. So yes, over the years, we've become much more inclusive of having doulas as part of that team to be able to help with that. We've been able to learn that outcomes, maternal and fetal outcomes, are much better with including doulas as a part of the teams. We have regular, educational sessions for the teams, for the physicians and the advanced practice providers, so that we can learn all the latest and the greatest so that we were able to provide the best for our patients.
Are there any challenges or barriers in integrating doula care within traditional hospital settings?
I don't really see any barriers per se, especially at this point in time. I feel like we've been much more inclusive. In the past, there were, COVID, we had restrictions and things like that where, you could only have so many people in the rooms and things like that. But at this point, we do have it so that, doulas are included, including in cesarean sections, which is nice because, you're allowing for them to be able to feel like that communication is continuing along the way. So I feel like the education has continued and it's really just improved, and we continue to learn things along the way, and it's gotten better.
African American mothers experience about 3 times the risk of an infant death compared to white mothers. And that is disturbing. From your perspective, what are some of the most effective ways to improve maternal health outcomes in underserved communities or in any community?
Some of the best ways would be to educate, taking the education to the community. So actually going out into the communities and bringing that education there so that there's not that fear that, the fear of what's going to happen at the hospital level, especially fear from physicians, right? Because, sometimes there's that lack of trust that is there.
What is that?
Well, I think that the lack of trust is that, it's PTSD, right? I mean, I think that, or post-traumatic stress disorder, there's something that's happened maybe from generation to generation, or that's happened to that person in the past. And if it's happened before, something, even if it's not this thing, this birth or whatever, it's real to that person, right? So we, as the healthcare provider, whether it's the physician or the advanced practice provider, the nurse, midwife, the doula, whoever, we have to meet that person where they're at, and we have to learn how to work with that person, right?
Absolutely.
And so we have to do that. And so we have to work as a team. I'm circling back a little bit, but we do have to educate them so that we have to hear from them what their fears are, but sometimes we have to go to them. And so we have to come into the community wherever that happens to be, whoever that happens to be, so that we can learn from them what those fears are. And sometimes we don't know what we're trying to educate on. So we have to come out there and come to the place and kind of figure out and then educate, right? Because we're bottled up with all this information, but then we can bring it out.
That's a very interesting perspective from the point of being bottled up, and also knowing that you do know your aunt, you know your mother, and those individuals have traditionally stepped into the doula role.
Exactly.
Have you had a change of a thought about the roles of doulas in your practice? And how many years have you been practicing?
Yes. So I've been out of residency for almost 23 years, been a physician for 26. And I'm telling you, yes, absolutely. And sometimes, these mothers, aunts, sisters, et cetera, cousins, et cetera, are acting as these doulas, right? They're coming in and they're as family members, right? But there's these years of wisdom, right? These years of experience that they're, and then you have these other, doulas who are coming in, and they're having these certifications, which is great. Having the certification is really great. Learning the different things, so that way they know how to go through and, help even more if they haven't actually necessarily gone through, because there's different things, right? You have the learned experience. It's kind of like I have the learned experience of training, but I also have learned experience of going through what I've gone through. But you have the training, and so I'm not negating the aunt who hasn't gone through the training, right? Because there's the thing that she's gone through. She has the family history. So we've got to listen to the aunt.
It's like the best cook in the family, right?
Exactly. So just because she doesn't have the certification doesn't mean we shouldn't listen to her. We should absolutely listen to her, because, maybe she's got the answer to what's happening to, her niece, So we really need to listen. And so we've learned that in medical school too. My partners know that. My partners here at this practice know that. All of our APPs know that. The people at the hospital, they know that, right? We've been learning that even more and more over the years. Stop and listen to the patient.
Can you share a specific example where a collaboration approach between you and a doula positively impacted you or your patient?
Absolutely. I have so many great stories. However, I will reference one where there was a doula who was in with a particular patient who there was a struggle with the spouse who just didn't know what to do. Really just didn't have an idea, how he could help his, significant other. And she was just, going back and forth and, teaching him all the different ways that he could, intervene and help with, his spouse to be able to, move in different directions and, comfort her. And I enjoyed, helping, seeing, that interaction. And then also there were some communication gaps in that space as well. And it was nice to be able to work as a team with the nurse and, with the doula and myself and, the resident. And we all came together to be able to have a shared understanding as far as, how to move forward with next steps. And so that was a wonderful interaction. So that's really how it should go, right? As a team, and not necessarily having, one person make the decision, right? It's ultimately the patient, gets to make the decision about, what happens with her body, right? But as a team, we were able to, help that patient to be able to understand how that situation was going. And the doula was integral in being able to help us to communicate with that patient and able to make the help the spouse to make the patient feel a bit more comfortable.
That's
so
an
that she could
interesting
understand.
space.
Yes.
So when you have a doula who is helping the mother and the father, does that
Yes.
make your job, or mother and the partner, does that
Yes.
make your job easier, a little easier?
Absolutely. Absolutely. Again, as a team, it helps us to, it helps. It really does, because, when the partner feels uncomfortable and feels sort of, at odds, it doesn't understand, where they fit in that space, the patient feels, how we are as gatekeepers, right? I always say we're the gatekeepers. We're looking out for our significant others to try to feel like, are they okay, right? So they're looking out for their baby, they're looking out for their partner, and then the patient can relax a bit when they feel like their significant other is okay too.
We spoke to doulas about their experiences, and each one had different experiences, but each doula had something to bring to the table that could teach someone else how to manage in this new space.
My name is Candace Ross with Divine Mama Doula. I am a certified doula, a community breastfeeding specialist, and soon to be a certified placenta encapsulation specialist. I've always wanted to be involved in birth work. However, I never knew what a doula was. Like many people, it's just, it's always been a thing, but it's become more worldwide awareness with doulas now. And my own birth experiences brought me to this point with wanting to definitely be there to support other mothers with birthing and postpartum services.
What would you say is one of the most important services that you could provide, so as a postpartum doula? And explain what a postpartum doula is.
Okay. Well, for me, I think what's going to be the most important thing is the presence. The presence alone. Not a lot of women, not everyone has a village. And that's where a doula comes in, help out with household chores, support for the mother, support for the baby, breastfeeding knowledge and support, meal prep. My background with culinary will come in hand with that, making them support meals that will be nutritious and support their breastfeeding journey if that's the route that they should choose to go on. errand running. Not everyone can just leave the home, and it's a time for rest. It's a time to be at home and bond with the baby. So, helping out with housekeeping, light housekeeping chores, and just being there.
As far as your doula experience, what kind of support or mentorship do you think that doulas should get while they're, just starting out?
Mm-hmm. Well, we get trained, but then we kind of get thrown out there to the wolves. I think hands-on, shadowing another doula, experienced doula would definitely be great. Being out there is what it is, and just learning book work or just learning, training verbally is not enough. So definitely hands-on training and shadowing other doulas would be amazing.
What do you think about having a relationship? Let's talk about the prohibitive cost of certifications.
Well, with my training was free. I was privileged to be a part of the Ingham County Helping Us Grow cohort, so I didn't have any cost for that. But if I want to do any trainings further and get DONA certified, there's cost to that. My breastfeeding training, that was free as well. I was a recipient of another scholarship for that, so I appreciate that. The placenta encapsulation for me is where the cost is going to come in, because everything that I need, my equipment, my supplies, the certification, which wasn't very expensive, but I had to pay for all of those things up front, and it's kept me from moving forward with my training and my certification, because it's out of pocket expense that I just don't have right now. So
it's interesting how the cost can keep a professional from doing their job. What do you think should happen? Where do you think we could get funding from for us to help birthing parents? And as we both know, having a doula really helps the prenatal birth rate exponentially. So how do you feel about groups coming together to have one class, or do you think that there should just be a singular class? Do you think a group should have a group rate for DONA? How do you think that works out?
Well, with DONA, with my training, after I think they give you up to like 90 days or something after your training, DONA would offer us a discounted rate, but I still couldn't really afford that at the time, and I wasn't prepared for that. But definitely, to take advantage of all the scholarships that are out there, it's competitive. To be able to do that, you have to be, accepted. But as far as the cost for things, I think individually it's just up to us.
Thank you so much for being here today. Tell us who you are.
My name's Lindsay Thompson. I own Doulas of Lansing. I'm a birth postpartum doula. I do childbirth education, and I do sleep coaching, and I run a team of doulas that help support families throughout the area.
Tell me about the connectivity that a doula should have with a client.
Well, we are building a pretty intimate relationship with our clients. We're going to be part of, this very memorable part of their lives. It's an imprint that lasts on them throughout their whole journey as parents and the rest of their time. So we feel really honored to be welcomed into their space. And it's also, I hear from my clients that they feel safe around us. They feel confident in being their true authentic self, telling us what's really happening. You need to be able to really speak what's on your mind and not be afraid of judgment. And it's really important to me, and always has been, to be a non-judgmental support person, and not bringing my own agenda to the table, and not bringing my own ideas about what I think birth should or should not look like, and really just supporting families through what their vision is and helping them achieve their goals. So through all of that, we build a connection. And I think that's one big difference about having a doula at your birth, is that you have somebody with you that you've been able to form that like friendship and relationship with, versus nurses that are amazing, yet you don't know them until the day you meet them. And then your provider.
I never thought about it that way. I think that sometimes we just look at it as the separation of certification or education. What do you think about doulas being certified as opposed to doulas that are not certified? I know that anyone can be a doula, but are you certified?
I am certified, yes. Interestingly enough, I was a doula before I even knew what a doula was. Many years ago, a friend of mine, like right after high school, her husband was in the military and she needed somebody to be her support person while he was on leave. And so I went to her childbirth classes at the time and was her support person. Had never even heard of what a doula was. Fast forward to, 16 years ago, and I had a doula at my birth, and I learned about them and realized that was what I was called to do. And initially had gone through a training, and trainings, I think, calling yourself a doula is somebody who, saying you're somebody who supports birth and birthing persons through their experience. But a training is really key and important to learning just, some of the key things and how to support families in the best way. And then taking that the next step and becoming certified adds a level of accountability to yourself and to others and to the organization that you choose to follow a certain set of guidelines or a certain set of core principles that they've defined. So I found value in it. I've trained with multiple organizations and certified more than once, just because it was important to me to build on what I'd grown initially. But then at the same time, there are people who choose not to certify or haven't been able to, or certain types of doulas and training organizations just don't lend themselves to that, and that's okay too. It's just it's an option that's out there, and I do think that it's helping us, especially as we learn to or begin to accept insurance, Medicaid coverage. Having a training is required, and while we don't require certification in order to accept insurance, I see it potentially changing in the future, and I just see it adding to our professionalism and our how others interpret us as professionals, because almost all professions in the healthcare industry require some level of certification or licensure or something along those lines, and so I just see it kind of aligning with what they know.
Do you have to take continuing education? Because I know you're always taking classes, but I never really know. I've never really asked you, is there a continuing education?
So there are different components to each organization and what they require if you decide to become certified, and that's what's really unique about this industry, is there's no formalized core set of training requirements, because every organization has created their own program and has created their own requirements. So to compare one organization to another is maybe not, it's not as simple as that.
How do people contact you?
Well, a lot of times people find us through a internet search, right? They find us on Google, or word of mouth is another big way that people learn about us. Families shared who they had a positive experience with, and post in groups and ask for recommendations. And so a lot of doulas receive clients through word of mouth. We get, I would say, 50-50 as far as people directly contacting me through our website. So they'll contact us and reach out and ask about our services.
It's growing, isn't it?
Yeah, there are so many more doulas now than there were back when I first started.
What about clients? Is the client base growing?
I mean, there are, I don't know the number off the top of my head, but there are, so many women giving birth every year. And there's never going to be enough doulas for all the people that could benefit. But over the last few years, it's becoming more well known, and more people are hiring doulas than have in the past. And more people are able to get support from doulas because we've kind of got more avenues to get doula support.
My name is Abriana Richardson. I am the CEO of Doula Food LLC. I blend aesthetic services with doula services, so that way I can go in and help before and after the baby is born, and then also offer them services like skincare or waxing or just that peer support that they need.
What you're offering is different from normal doula services by themselves. I feel it's really important for a doula to have more than one service that they provide to their clients. And you are both a birth doula and a postpartum doula, but you also provide services that help women feel beautiful. How does that blend together for you?
So for me, it's been rewarding. I get to see them person. I get to see them in their most, what is the word?
Vulnerable state.
Yes, vulnerable state, but also like when they're feeling good too. So I get to see them when they need help, and then when they're feeling, like they're on top of the world too. So it's been a whirlwind to see them grow from being a mom and then having to switch up between being a woman too. So it's been rewarding for both sides.
What kind of services do you provide as a doula?
So as a doula, I am a birth doula as well as postpartum doula. So as a birth doula, I go in before baby is born, so I can assist with birth plans. I can assist them with their prenatal visits. If they have like good questions, we can also do different prenatal visits up until the baby is born, and then after the baby is born, I can go in and help them with services like feeding or breastfeeding, I should say, or cleaning.
Just little things to help mommy's life be beautiful and for mommy to be more productive, because you can't always fall asleep while the baby is sleeping because you think that there's so much to do.
Yes, ma'am. And sometimes having a baby, everything isn't planned. So just having that doula there, it gives them that gap, so we can fill it and help them answer questions that they need help.
How does having a doula help the father with the mother's needs or the baby's needs and his needs as well, because he's learning as well?
See, and that's the beautiful part about being a doula. So my whole purpose of being a doula and my role is to make sure that everybody's emotions are centered, whether it's mom, whether it's parent, family, grandma. So we kind of just look at everything together, and then just learn our options, so that we can support dad, we can support mom, support grandparents, siblings, and so that way if mom wants to scream, she can scream at us. If she wants to hold her hand, she can hold her hand, or if dad has a question or grandma or whatever, we're always there to support everyone in that matter.
I know that you're a mom of 3.
Yes, ma'am.
How important were your certifications during your last pregnancy?
For me, it was, oh my goodness, so important because it was not planned at all. So I wanted to have a natural birth, a home birth. I tried and it did not work. And with this baby, she said, no, this is what we're doing and I'm coming. And I'm like, oh goodness. So I was able to demonstrate some of those breathing practices that I had learned in my certification.
And you were by yourself?
Yes, I was by myself.
With your 2 children?
Yes.
In your house?
Yes, ma'am. So it was, I'm like, yeah, no, what did I learn? Like, 'cause everything has to come right now because I'm like, where's the breathing? But just countermeasures too. Like my daughter, she is 3 years old, but she was like my first nurse. So she brought me some water. She was like rubbing my back, and like this is like things that we learn to be certified to become a doula. So I'm like, this baby, like you just okay, make us help me, please, because goodness. So just with that alone, it was able to help me stay calmer too, I think, because I knew kind of what to expect. I kind of knew a little bit of what to do at the time, because I was having to go back and forth between mom and doula. And I'm like, okay, what am I going to advocate for this time? Because I don't know. So it's been a good experience.
So what happened?
So but I thought I was getting ready to go to the bathroom, and no, like I'm like crawling to the toilet to go, and I couldn't move, and she just like dropped out. So I was like catch her and scoop her up and clean her off with a blanket, and then after that she didn't even cry. Like she just like looked like she like opened her eyes, closed them, then I put her on me, and she latched like instantly.
So you breastfed her immediately after birth. Was she still connected to the umbilical?
Yeah, so even with that, so delayed cord clamping, like me constantly my placenta, everything that I wanted to do, I was able to do, and I was able to be a doula advocate for that on my own. And I was able to do that
In your house?
Yes, in my house too, but then also in the hospital. So I get to the hospital, I see like the nurses and doctors, and they're like trying to hook me up to machines. I'm like, I kind of know what to expect now. So I know this is not the right procedure, but I'll let them go ahead and do what they do. But then I also tell them who I am and what I do.
So you were able to actually advocate for yourself?
Yes.
I'm super proud of you, because I would have been totally freaking out.
Yeah, no, pregnancy is always scary for me though. Because I did have a aunt to pass away from labor after a C-section. And I think after me, because I didn't even know what a doula was until after I started to have kids of my own. And so after learning that what a doula is, and that there's so many different types of doulas, and like all what we can do before and after and during the birth, I'm like, that's where I need to be. That's where I feel most comfortable. So
do you feel like you were born to do yours?
Now that I'm looking over my life, yes.
We enjoy, as an organization, working with other organizations that support the mission of mothers, fathers, family, and community.